Let's turn now to Dr. Paul Offit. He is a member of the FDA Vaccine Advisory Committee and the director of the Vaccine Education Center at Children's Hospital of Philadelphia. Dr. Offit, good morning to you. Well, look, it is beginning to feel a lot like last Christmas with cases surging. So the big question, I guess, this morning is how quickly is the Omicron variant spreading and how should we adjust our holiday plans?
Well, it has a doubling time of 2 days, which is much worse than Delta. Actually, I thought nothing could be more contagious than Delta, but this virus is, and it will no doubt take over in the United States. The good news is that even if you've gotten just 2 doses of mRNA vaccine, you have a 70% chance of being protected against severe illness. However, you have a 0% chance if you're not vaccinated, and that's the problem. I mean, you're seeing a surge now. It's because this is a winter virus, and if you work in a hospital, as I did about a week and a half ago, virtually all the cases you see are in the unvaccinated. Vaccinate yourself and you can be protected against this virus.
So, Dr. Offit, walk us through this, though, for a second, because I feel like everybody feels like they now know someone who has tested positive recently. In a lot of cases, those folks are vaccinated. So how effective is the vaccine right now against Omicron, and how worried should we be about all these anecdotal cases we're hearing?
Again, there's a difference between severe illness and mild illness or asymptomatic infections. Both natural infection and vaccination are very good at protecting against serious illness, and that's been true for all 3 variants that have come into this country, and I think that will likely be true for this variant as well. The problem is that neither infection, natural infection or vaccination, are very good at protecting against mild disease. So when you talk about cases, you would expect to see an increase in cases, especially in the winter months. What there should be eventually, and I think we're going to start to see this, is a dissociation between cases and serious cases. In some ways, I wish we'd stop following cases and just look at hospitalizations, ICU admissions, and deaths, because those are really the key numbers.
Well, let me follow up with you on that very point, because you are saying that it does have a high rate of transmissibility. But given the data that we have now, do you think people are getting sicker with this variant? What do we know so far?
It's hard to know. I mean, the UK data suggests that this virus may be as virulent as previous viruses. I think time will tell on that. But you know, if you look actually at sort of South African data, what's interesting is when they had sort of the beta variant sweep through their country, you'd see a dramatic increase in cases and hospitalizations and deaths. And then that was also true when the Delta variant swept through their country. Increased cases and clear increase in deaths and hospitalizations. It really wasn't true for Omicron. When Omicron swept through their country, clearly there were a dramatic increase in cases, but it wasn't as big of an increase in hospitalizations and deaths. And I think that's why you really have to focus on that. But again, get vaccinated and you can avoid much of the serious disease associated with this disease.
And Dr. Offit, you specialize in vaccine for children. Can you give us a sense of what we should make of Pfizer's news that it's going to take longer than they had initially hoped for to get that shot together, the plan, the regimen for children under 5?
It was disappointing. I mean, when we looked at the data at our committee for the 5 to 11-year-old, the immune response was the same, really, independent of whether you were 5, 6, 7, 8, 9, 10, 11. That wasn't true here for the younger child, for the 6-month-old to 5-year-old child, whereas you got a good immune response in the younger portion of those children. When you got to sort of the 3- and 4-year-old, right, the immune response wasn't as good. So I think they're going to have to readjust what their dosing strategy is.
All right, Dr. Paul Offit, you always have wonderful information. Thank you so much. Good to see you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.